How do insurance monopolies and government subsidies lead to higher healthcare costs? Here's an example to explain why. When you go to the gas station and you want to buy a six-pack of beer, it costs around $6 or $7. But when you go to the restaurant and you buy just one beer, it also costs around $6 or $7. This is because restaurants know that people who can afford to go and dine out can also afford to pay more for beer. The restaurants charge them more so they can make as much money as possible. Healthcare works the same way. Healthcare providers like pharmaceutical companies and hospitals know that insurance companies and the government can pay more for healthcare than individual consumers. So they charge them more so the hospitals make as much money as possible. What's the solution to the problem then? It's a free market healthcare system that gives consumers choice. When you go to the supermarket and you want to buy bread, you see you have multiple options, a lot of companies to choose from. If one of those companies decided to charge people more for bread, no one will buy from them because they have so many other options. Healthcare should work the same way. The problem is that there are so many regulations, small and locally owned insurance companies cannot afford to comply with these regulations. So therefore, there's not a lot of competition and monopolies take over. Regulations should be minimized. That way, more insurance companies can compete with one another and charge lower prices. If one of the companies charges more, then no one's going to buy from them and they'll look at the other options. Likewise, healthcare providers are going to realize that those small insurance companies cannot afford to pay so much money for healthcare, so they will have to lower their prices. A free market capitalist healthcare and insurance industry are what work best for consumers and struggling families. It lowers their prices and it gives them so many options to choose from.